associated with St. Elizabeth's Health Center School for Nurse Anesthetists and Youngstown State University. For my doctoral project, the title was Wellness in the RNA Population, a Cross-Sectional Descriptive Survey. So with that, we'll go ahead and get started. First, some background and significance behind this topic. Student registered nurse anesthetists face very unique stressors. Some examples of the stressors that they face include balancing doctoral level didactic information with a very stressful and demanding clinical schedule, financial restrictions associated with not being employed, and also mastering advanced practice skills in a very comparatively short amount of time compared to other practitioners. There are also challenges associated with moving across the country for some to be involved in these programs. And these stressors all increase sRNA's risk of developing mental health challenges. The literature has suggested the use of nurse anesthesia program-sponsored wellness interventions to support the mental well-being of sRNAs. However, there is limited literature to suggest the use of those interventions for sRNAs. There's ample literature to support the use of these interventions for physicians, staff nurses, medical residents, allied healthcare professionals, but again, very limited for the student nurse anesthetist population. And so to start off this project, of course, I started with a literature review, because what's a doctoral project without a literature review? A series of sources were sought after, and the articles were selected from peer-reviewed journals with full-text articles that were focused on healthcare workers and providers. These were from both domestic and international peer-reviewed journals. And in order for this study to be selected, it had to discuss mental health challenges or interventions used to address those challenges. In all, 21 articles were selected for review, and also one anesthesia-focused podcast, which featured a professor who is very respected in the anesthesia community with regards to wellness interventions. So, a few themes were identified in this literature. The first was that there are indeed multiple stressors that sRNAs are presented with, and in a study conducted in 2012, sRNAs had an average daily stress level of 7.2 out of 10, and that was compared to certified registered nurse anesthetists who had a daily average stress level of 4.7 out of 10. So almost 1.5 times the amount of stress compared to those professionals who had already passed their certification exam and were practicing providers. These stressors will decrease self-efficacy, and which can increase perceived stress and burnout. The second theme that was identified in the literature was that a culture of wellness must be cultivated within both academic and clinical organizations in order for wellness interventions to succeed. The third theme was that mindfulness is an especially effective intervention in reducing perceived stress. Lastly, the fourth theme was that wellness interventions must be multifaceted and flexible. In this context, multifaceted means that both organizational and individual approaches for wellness need to be used in order to have an effect for those individuals that are participating. And flexible means that these interventions must be adjusted to meet the needs of the participants. There were some discrepancies in this literature review, including populations of focus. Again, there was lots of data that was supported the use of wellness interventions for physicians, resident physicians, staff nurses, and so forth, but very limited for the use of sRNAs, less than half a dozen articles focused on sRNAs specifically. Also measured stressors. Some studies focused specifically on depression and anxiety, while others focused on burnout, stress, suicidal ideation, and any mix of those. Other discrepancies were utilized interventions. It could have been mindfulness, it could have been wellness days. There was no superior wellness intervention that was identified within this literature review. Hence the need for wellness interventions that are multifaceted and flexible. Okay. Some missing literature is evidence of long-term benefit of wellness interventions. However, that is a wonderful future opportunity for research. Also, a comparison of sRNA stress to the stress of other healthcare workers other than cRNAs. Some objective data reflecting the effectiveness of wellness interventions is also missing and would be helpful in the future. And also, lastly, how to best adjust interventions according to the needs of participants, how to make those interventions more flexible. So, with all of this in mind, this literature review and everything that we found within it helped us to find the purpose of this project, which was to examine the perceived stress, burnout, and wellness in SRNAs and to identify wellness interventions that are utilized in nurse anesthesia programs. So, some objectives that existed within this project were to measure the prevalence of perceived stress and burnout among SRNAs in the United States. This objective was achieved first by measuring perceived stress by the 10-item perceived stress scale, or the PSS-10, and the level of perceived burnout was measured using the Copenhagen Burnout Inventory, or the CBI. The second objective was to identify the wellness interventions that were used by nurse anesthesia programs, and this objective was accomplished through the administration of an author-created survey which inquired about the use of wellness interventions by nurse anesthesia programs. Third objective, to identify if SRNAs felt these interventions that were in place met their needs. Again, this was accomplished through the administration of an author-created survey about wellness interventions that are used by nurse anesthesia programs and students' perceptions of these interventions. Lastly, this is kind of a mouthful, so stick with me. This fourth objective was to evaluate if there was a statistically significant difference in perceived stress and burnout in SRNAs enrolled in nurse anesthesia programs that used wellness interventions compared to those SRNAs enrolled in nurse anesthesia programs that did not use wellness interventions. And this was done to determine, again, if there were any statistically significant differences between these two populations of SRNAs. So, the project framework for this project was the Community of Healing model, which was developed by Dr. Beverly Hancock. Within this framework, the individual is the focus, and they are supported by peers, and together they make up a community of healing. Within this context, nurse leaders, or in this context, nurse anesthesia program directors are responsible for overseeing the wellness of SRNAs, and they are responsible for participating in wellness interventions and encouraging that SRNAs do the same. So they monitor well-being, they survey the status of their students, they identify any potential challenges to well-being, such as stress or burnout, and they intervene to either prevent or reduce those mental health challenges. So, project methodology. This was a cross-sectional, descriptive online survey of SRNA perceived stress and burnout, wellness interventions used by nurse anesthesia programs, and SRNA perceptions of those interventions. This was done using an online survey that was created using Microsoft Forms, which was provided to YSU students for free. Key personnel that were in this project included Dr. Amy Weaver, who was the project chair, as well as Kim Brownlee, who was a committee member and a nurse anesthetist associated with Mercy Health. Participants included first, second, and third year student registered nurse anesthetists enrolled in nurse anesthesia programs across the United States, and that includes 130 nurse anesthesia programs. Recruitment strategies included sending an online survey to nurse anesthesia program directors and administrative assistants. Within that email, they were able to view an introduction letter as well as a brief synopsis of the survey. They also were able to view the consent form that students were to read upon request. Per their judgment, they were then free to forward that survey to student registered nurse anesthetists, and those student registered nurse anesthetists could then view the survey and choose whether or not to complete it after signing a consent form. Again, the data collection instruments that were used included demographic questions, the PSS-10, the CBI, and an author-created survey which assessed the use of wellness interventions by nurse anesthesia programs. Demographic questions included questions about sex assigned at birth, ethnicity, marital status, years of nursing experience prior to becoming an SRNA, and anesthesia program characteristics. The average time for completion for this survey was 26 minutes and 30 seconds. Okay, and of course, prior to completing this survey, we submitted a synopsis of the survey to the institutional review boards of both Youngstown State University and Mercy Health, and they both deemed that this project was exempt from IRB oversight. Okay, so some results. From January 2nd, 2023, which was when the initial survey was first emailed to nurse anesthesia program directors, to February 4th, 2023, 508 SRNAs participated in the survey. Students were not required to answer all questions, and so the total number of responses did differ from question to question. And I think the smallest amount of responses that we got for one question was 476. So we had very, very good sample size. This is just a bird's eye view of the demographic that we had in the survey. As you can see, most participants were female. Oh, you can't see. There we go. As you can see, most participants were female. Most were white or Caucasian. And most tended to be between the ages of 25 and 31 years of age. Most SRNAs reported enrollment in a front-loaded program, and the majority of them were married or in domestic partnerships, followed closely by SRNAs who were single and had never been married. And about 489 participants were enrolled in the anesthesia programs that offered doctoral degrees, and 18 were enrolled in anesthesia programs that offered a master's degree. Many of the participants were in their third year of their SRNA education, followed closely by first and second years respectively. And lastly, most of them had 1 to 5 years of nursing experience prior to becoming an SRNA. Okay, so again, this is a very quick bird's eye view of the results here. These are the results of the 10-item perceived stress scale. In order to score this, students were asked to select one of 5 questions that were arranged in a Likert scale, ranging from strongly disagree to strongly agree. And the total score was brought from this scale, and the higher you were, closer to 40, the greater amount of perceived stress you had. And this is arranged in percentages and according to populations. As you can see, the green represents low perceived stress, the yellow represents moderate perceived stress, and red represents high perceived stress. Amongst all of the populations, the mean percentage of low perceived stress was around 24.2%. The mean percentage of moderate perceived stress was around 63.4%, and the mean percentage of high perceived stress was 12.4%. Now, the Copenhagen Burnout Inventory is divided into 3 different categories, including personal burnout, work-related burnout, and client-related burnout. And so each one of these scales were scored separately, and we're able to help shed light upon some of the sources of SRNA burnout. Again, not very many significant differences between populations. If you see more red or more green within a classification, chances are that comes from a much smaller sample size within that demographic. So roughly 27.3% of SRNAs within all demographic groups had a low amount of perceived personal burnout, and roughly 72.8% of SRNAs had a high amount of perceived personal burnout. Same rules apply to work-related burnout, where 40.2% of SRNAs had a low perceived burnout that was work-related, and about 60% had a high amount of work-related perceived burnout. Lastly, for client-related burnout, there really wasn't much significant burnout within this category. About 88.5% of SRNAs had scored low for having client-related perceived burnout, and about 11.5% scored for having a high perceived amount of client-related burnout. Okay, so this is a discussion about the author-created survey. These first 3 questions that you see here, all SRNAs were invited to answer these questions. This first question states, my anesthesia program has the responsibility to prioritize the mental well-being of SRNAs. Roughly 60% of SRNAs either agreed or strongly agreed with this statement, while roughly 16% strongly disagreed or disagreed, and about 18.5% neither agreed nor disagreed. The results were similar for this second question, which states my anesthesia program has the capacity to prioritize the mental well-being of SRNAs. Again, close to 60% agreed or strongly disagreed, about 18 to 19% strongly disagreed or disagreed, and 21% neither agreed nor disagreed. Now for this third question, SRNAs were invited to indicate whether their anesthesia program offered at least one wellness intervention. And in this context, utilization was defined as nurse anesthesia program directors either encourage the use of these interventions, or they require them, or they make those resources available to SRNAs so that they can be more easily utilized. About 59.1% of SRNAs said yes, their nurse anesthesia program did require the use of wellness interventions or utilize them. And about 40.9% said no, their SRNA program did not provide any wellness interventions. So SRNAs who answered yes to question 3 were then directed to these 2 questions. And in the first, they were asked if they felt that they were less stressed because their nurse anesthesia program utilized wellness interventions. Only about 19% agreed or strongly agreed with this statement. And it looks like about 40-ish, 35 to 40% disagreed or strongly disagreed with this statement, and 42.4% neither agreed nor disagreed. The second question was similar, where they were asked, I feel that I am less burnt out because my nurse anesthesia program utilizes wellness interventions. Again, about 19% agreed or strongly agreed. Close to 40% strongly disagreed or disagreed, and 39.6% neither agreed nor disagreed. SRNAs who answered no to question 3 were then directed to this question, which says, I feel that I would experience decreased levels of stress and or burnout if my anesthesia program utilized the use of at least one wellness intervention. Now, close to 70% of SRNAs either agreed or strongly agreed with this statement. Close to 8% disagreed or strongly disagreed, and 21.7% neither agreed nor disagreed. And so this has a couple of implications here. It could imply that the SRNAs who are enrolled in nurse anesthesia programs that do use wellness interventions may not have a full grasp of the impact that those interventions have. And the SRNAs who were enrolled in nurse anesthesia programs that do not use wellness interventions are understandably stressed, and they feel like they need something to help to reduce the amounts of stress that they're feeling. So just a few implications that we can glean just from looking at this drawdown. These SRNAs were also invited to indicate the wellness interventions that were utilized or encouraged by their nurse anesthesia programs. And for these questions, they were invited to select all that apply, because those are every nurse's favorite questions to answer. In this first column here, these of course only apply to the SRNAs who said that their nurse anesthesia programs did utilize wellness interventions. The most frequently selected option was access to counseling with a frequency of 212, followed by physical exercise, either as an individual or in groups, with 129, and mindfulness activities at 128 responses. In the second column here, all SRNAs were invited to indicate the interventions that they felt would be helpful in their programs to decrease levels of stress and or burnout. The most frequently selected option was excused mental health or sick days with 331 selections. This was not even closely followed by the second most frequently selected option, which was social activities with a frequency of 200. The third most selected option was organized wellness curriculum with 185 votes. Now lastly, to address the fourth objective of this DNP project, the SRNAs that were enrolled in nurse anesthesia programs that used wellness interventions were compared to SRNAs that were enrolled in nurse anesthesia programs that did not use wellness interventions. This grouping variable was used from the third question from a couple slides ago that simply asked if yes, they used interventions or no, they did not. These two groups of SRNAs were then compared to each other, with the basis of comparison being the perceived levels of stress and burnout. This was tested for significance using the Wilcoxon sign break test, and within this test, it was determined that the mean perceived stress, personal burnout, and work-related burnout was lower in the SRNA population that was enrolled in nurse anesthesia programs that did use wellness interventions, and the differences between the two populations were statistically significant with a p-value of 0.0000. However, there were no significant statistical differences found in perceived client-related burnout. So are these interventions effective to help decrease SRNA burnout and stress? Maybe, maybe not. It could be explained by the wellness interventions. It could also be explained by an unaccounted for confounding factor. However, this was still a very telling DNP project, and it was a pleasure to take part of it. Lastly, we looked a little bit at some of the information that we gleaned from the last question of the survey. For this question, SRNAs had an opportunity to provide any feedback. 87 SRNAs opted to participate in this portion of the survey. It was not required. And there were several different kinds of comments that were made within this survey. There were over 20 different themes that could readily be identified just from those 87 comments alone. However, the committee associated with this project narrowed it down to the three most frequently used themes. The first theme was the theme of time. And this theme was identified because many SRNAs expressed the viewpoint that excused time away from clinical or academic activities would do more for their mental health than any established wellness intervention could do for their mental health. There was also a perception that nurse anesthesia programs may have unrealistic time expectations, as there are many activities that we have to participate in to meet the requirements, and many of these activities may exceed the hours of the day. Yeah, I know. Tell me I'm wrong. There was also a perception amongst SRNAs that some nurse anesthesia programs were not considerate of their time. For example, one SRNA discussed that in order to participate in a mandatory wellness intervention, he and his classmates had to drive several hours to take a 30-minute walk in the park. And that was their wellness day. And that's no judgment from me, but that's just their perception. The second theme that was identified in this qualitative data was challenges that SRNAs chose to discuss about their programs. Many SRNAs felt that wellness was not a priority within their programs. Some said verbatim that their nurse anesthesia program directors did not care about wellness. Some even said that the interventions that they participated in did not meet their wellness needs, and that those interventions paradoxically increased their stress. The quantitative data suggested otherwise, however, this is still their perception. Lastly, the third theme that was identified were a few positives. There were only about 6 positive comments, but I still think that they are still important to mention because they give us a lot of information about wellness interventions that can be helpful for SRNAs. A lot of them discussed established exercise routines. They talked about the utilization of self-help apps and regular counseling appointments and positive affirmation. And all of these patterns being established prior to even starting CRNA school. So, within the context of this DNP project, and also according to the literature review and the framework for this project, some recommendations were made by this DNP committee. The first was for SRNAs to utilize individual interventions. Even though many feel that, many have the perception that nurse anesthesia programs are responsible for prioritizing the wellness. Thank you.
Mm-hmm.
Sorry. Amy's down there going, probably all like, what's going on? Sorry. Okay. Even though nurse anesthesia programs can and should use wellness interventions, we have to refer back to the fourth theme of the literature review, which is that both individual and organizational interventions should be utilized. And it takes time for organizations to identify barriers to wellness and to make plans to address those barriers. And so in the meantime, SRNAs must participate in their own wellness while also assisting in the development of wellness interventions for organizations. The second recommendation was for nurse anesthesia program directors to demonstrate that they are actively engaged in wellness interventions. A few suggestions by the committee for this to occur is for nurse anesthesia program directors to conduct 10 to 15 minute mindfulness sessions at the beginning of classes, preferably by somebody who has been formally trained in conducting mindfulness sessions, and also discussing with SRNAs what they have done with their wellness to address their wellness in the week. They can also identify potential barriers to wellness within academic and clinical settings, such as negative cultures, bullying, and so forth. And they can make plans within their power to address these challenges. The third recommendation was to possibly make reasonable accommodation for wellness days, which involves examining the amount of time that is required by the American Association of Nurse Anesthesia and the Council of Accreditation to graduate from an anesthesia program, to examine their own programs and the average number of hours that student nurse anesthetists spend in clinical, and making reasonable accommodations for excused mental health and sickness days. And this can even include having days off during holidays and breaks between semesters, which some programs do not offer. Lastly, nurse anesthesia program directors and SRNAs can both work together to organize time-conscious social activities which can take place around class time and around clinical, so that SRNAs do not have to make special trips to participate in these interventions. And these are my references. Does anybody have any questions?